Okay, good afternoon, everybody. We have a really, really exciting presentation today. We'll get to that in just a minute. But first, our usual housekeeping notes. Make sure to sign in. Please RSVP so we can better prepare for the next session. Online participants, please keep your mics muted unless asking a question. Keep video turned off. We have several really exciting talks coming up. Human Birth Defects by Salil Laki from the University of Delaware on May the 20th. And then Kirk Garrett on June the 3rd will be talking about optimizing value through appropriate use of invasive cardiovascular procedures. Full schedule, as you will know, is on the ACCEL website, and all of our previous presentations were recorded on the website. We also have a very exciting time today because our wonderful project officers are here from NIGMS. We have Raphael Garaspi, and still getting food in the back, covering the room here from all angles, Regine Dothard. They've been extremely supportive of us in the ACCEL Delaware CTR. We also have our PI, is also here, Stuart Binder-McLeod, who you all know. So how could it be more exciting? And that is, we have Carolyn Cannuscio here from the University of Pennsylvania, who turns out to be the wife of a very good friend of mine and collaborator, Dan Rader. Dan and I have been friends actually for decades, and he collaborated with us on a major grant this year. Carolyn went to Brown undergraduate and then got a science master and a science doctorate at Harvard, the School of Public Health, and joined the faculty at the University of Pennsylvania, where she's assistant professor of family medicine and community health. So I think we're going to really have a very exciting talk today that fits in with so many of our interests. She's going to talk about innovative strategies for engaging vulnerable populations. Carol, thanks so much for coming. I've really been looking forward to this.
Thank you for the invitation, and I'm happy to be here with all of you, both here in person and virtually. And I would encourage any of you nearby or far away to ask questions during my talk. Don't hesitate to interrupt me if you need clarification or have a burning question. And I have no conflicts of interest to declare. So I was born a New Yorker, but am now a Philadelphian, and I'm a social epidemiologist by training, and those things taken together mean that I really can't ignore the fact that I live in the poorest of the 10 largest American cities. And much of my work and the work that you'll see today is really motivated by the urgency of the social problems that we can see every day in Philadelphia as residents of the city, and that I see in my work studying urban health disparities in Philadelphia. So this iconic photo and moment in Philadelphia is just a reminder that when many people think of Philadelphia, they think first of cheesesteaks and maybe tasty cakes. And we have therefore earned some dubious distinctions in Philadelphia as one of the fattest American cities, and of course the poorest of the largest American cities, and a city with very serious problems related to crime and violence in particular. But I look at this, and it's also a beautiful city, and a city of neighborhoods and of high social capital in many of those neighborhoods, of tremendous reliance on neighbors for support. And also the physical infrastructure of the city really reflects that, I think. If you look at a Philadelphia street scene, what you're seeing is that all of our homes lean on one another. And so my work is really motivated by trying to understand the city's assets and build on those assets and try to use those assets to overcome some of the many struggles that really impede health in Philadelphia. So before I get deeply into this work, which is really about community engagement, I want to ask you how many of you in the audience that I can see, because I can't see the raised hands on blue jeans, how many of you in this audience are primarily clinicians? Okay, maybe a third of the audience, primarily clinical. And how many of you are primarily researchers? Okay, and then how many of you consider your primary work to be in community engagement or community programming? A few people in the back of the room. Okay, so I would welcome any of you to reflect back to me how this work can be made more helpful for you in those roles as clinicians and researchers and community engaged public health workers. So the first partnership I'm going to tell you about is a partnership with the Mural Arts Program of Philadelphia, which is it's part city agency and part nonprofit, and it's the reason why if you drive through Philadelphia, you'll see thousands and thousands of murals. We have tremendous public art in the city of Philadelphia, and the leader of that program, Jane Golden, has really inspired a generation of artists who are highly committed to social change. And although I'm trained as an epidemiologist and usually our tool set is really about quantitative data analysis, what you'll see today is a radical departure from that, and one that I think capitalizes on the shared interests of this community organization and of our group at the Center for Public Health Initiatives at Penn. So when I read the Mural Arts Manifesto, they say, we believe art ignites change. We create art with others to transform places, individuals, communities, and institutions. Through this work, we establish new standards of excellence in the practice of public and contemporary art. Our process empowers artists to be change agents, stimulates dialogue about critical issues, and builds bridges of connection and understanding. Our work is created in service of a larger movement that values equity, fairness, and progress across all of society. So I think that you could probably insert yourselves and your line of work, and many of these objectives are actually shared objectives that reflect this interest in equity, fairness, and progress across all of society. But Mural Arts has radical ways of doing this, and also they approach their work with this great spirit of love for the city and the people in it. And they say, yo, this is fun. We're from Philly. We're for Philly, and we're having a hell of a good time. And I have to say, as a public health researcher working with the artists, I can share that joy. So for those of you who haven't had the benefit of being in Philadelphia, I hope you'll come and visit us and see the beautiful art that reflects our community. And all of these murals are painted with a lot of input from the local community about what images they want to see reflected around them. And then these are two-dimensional, but they actually reflect jobs programs in the community. Excuse me, and vulnerable youth are often engaged as workers on these projects, and they are trained by excellent artists and then can see their work produced in a very large scale in the city of Philadelphia. Okay, so what is social practice art? So the practitioners of social practice, this quote from the New York Times says, freely blur the lines among object making, performance, political activism, community organizing, environmentalism, and investigative journalism. The idea is to use art as a way of engaging the community and as a way of generating a great deal of dialogue about challenging social problems. And one of the inspirations for our own work in Philadelphia comes from the artist Rick Lowe, who has this project Row Houses, where he took over an ailing neighborhood full of these row houses and turned the row houses into housing for single mothers, as well as artists' live-work space, and revitalized the community in doing that. Provided really a practical resource through housing, but also provided social support. And you'll see in our project in Philadelphia how we drew on some of those strategies. And Project Row Houses has really been such a national model and has gained a tremendous amount of publicity in a way that public art projects rarely achieve. So our first project with Mural Arts Program was focused on youth housing insecurity, and my role in it was to help lead the creative team and to provide a focus on the health implications of youth housing insecurity. We have many, many community partners, as you can see here. Mural Arts is an incredibly powerful convener of not just funders, but also local service providers. And so you'll see how we try to weave social service provision throughout the production of art. Okay, so in Philadelphia, every night about 1,000 Philadelphia children and youth will sleep in a shelter. So this is really the tip of the iceberg when we're thinking about youth housing insecurity and homelessness, because as you may have been following in the news, there's a great deal of controversy about exactly how to define homelessness, and many of the young people we've worked with don't have a consistent place to sleep, but couch surf. They move from night to night with family and friends, and they don't have one reliable, secure place to live. They would not have been counted in this number. Okay, so our mission with this project is to engage and empower Philadelphia youth in order to understand how home, as they define it, contributes to or takes from their sense of well-being. And we also really wanted to increase awareness of how Philadelphia's socioeconomic diversity contributes to the health and life chances of residents. And our strategies, normally as an epidemiologist, I would rely on quantitative figures and present my data as graphs and charts, and you'll see a different way of taking data into stories and art. So one of the first things we did with the 40-odd youth who worked with us in the first stage of the project is that we wanted them to be real members of the creative team. And we set them out in Philadelphia with cameras, and we taught them how to systematically observe the housing circumstances of Philadelphia residents across the socioeconomic gradient. So we took one street, Spruce Street, that cuts across the city of Philadelphia from river to river and also cuts through neighborhoods that are very wealthy and goes through neighborhoods that are very poor. And we asked them to photograph every residential doorway along that corridor. And those photographs then became a stimulus for conversation among the youth about how housing concerns affect people across the socioeconomic gradient. And as you think about adolescence, and we were working with young people who were between the ages of 14 and 24, one of the very challenging things about working with adolescents, or maybe being a parent of an adolescent, is that the world as they see it is really all about them, and it's hard for them to see beyond that. And one thing this exercise did was, it made them part of our team because they understood the rules, they understood their task, and they were happy to participate in providing data. But the other thing it did was it broadened the conversation so that they weren't just thinking about their own housing circumstances, but they were able to see this kind of variation across the socioeconomic gradient and then talk about things like fairness and justice and inequity and the very deplorable living conditions in the most disadvantaged neighborhoods. What we then did was we gave the same young people cameras and we asked them to document their own housing challenges or housing circumstances. And this is young Adia, who was at the time pregnant and also struggling with her boyfriend Ferris about where to live. And here she's pictured with, she chose to include this picture of herself with Ferris's grandmother, who spoke only Vietnamese, but was one of Adia's most important adult connections and role models. And it's a consistent theme among the young people we work with that many of them landed in the foster care system early in life because of the death of a parent or the incarceration of a parent or separation due to other major social traumas in the family life. So here Adia chose to really focus on and show how important this adult is to her. And many of the conversations also centered around the desire for the security and feeling of a kitchen table where everyone could come together and share a meal. Of course, with housing insecurity comes food insecurity for many of these youth, and so they talk to us often about the challenges they faced in trying to find adequate shelter and adequate food. So these photographs that they took were the basis for interviews. We did photo elicitation interviews. I trained undergraduate students to help us do the interviews. I trained artists to help us do the interviews. We were all out in the community talking with these youth about their housing experiences. And then what happened next, normally we would take those interviews and analyze the interviews using qualitative data analysis methods that I believe my colleague Rosie Frasso taught to some of you. But here's where it gets exciting because I'm an epidemiologist, but I worked with artists, and we were also working in this Mantua neighborhood Mantua was one of the United States' first promise zones. 96% of the children in Mantua live under the poverty line. It's a really challenged neighborhood. And we worked on this one block, Mellon Street in Mantua, to engage neighbors and to get them involved in the conversation about housing insecurity and homelessness. And you can see down in the foreground of the photo, one of the altars that you often see in Philadelphia to someone who had been killed on Mellon Street. So Mellon Street is a site of very active drug trade. It's a street where neighbors rarely interact with one another. There was not much street life when we first came to Mellon Street. And yet we were given this home by a developer in Philadelphia to use as the site of an art house where we could both create art and distribute information about social resources. So you'll see what happened to Mellon Street after the artists were unleashed. The neighborhood residents were all encouraged to participate in a neighborhood cleanup, and many of the residents were eager to participate. There were some holdouts at first. The children did not hold back at all. They were highly involved and eager for the social mixing and attention from both their own neighbors and parents and the artists who came to work with them. And here are our interview transcripts being turned into art. So this is one of the things that happened was there was this exhibit in the art house, and here the artist Ernell Martinez took the stories that the young people had shared and this iconic image of the kitchen table, and he crafted out of paper mache this sculpture. And the sculpture actually, it makes you look like you could sit down at it, but in reality it's very fragile. The material is very fragile, and Ernell wanted to show this juxtaposition of the desire for security and home, but in fact how truly vulnerable most of these kids are. And when you go up to the wallpaper on the wall and to the table and chairs and to other pieces of furniture that are in the room, you can read some of the key words. You can read about people being on drugs and alcohol. My mother wasn't supposed to have more kids. I was so happy though, and I love her to death. You can read these kids' stories, and it's a new way of being invited into their lives, and not as dry a way as I would produce on my own in an academic manuscript. At the same time, the artist Cheryl Olinsky was working with youth to turn the visual images the kids took in their pictures and turn them into what she called guerrilla murals to get people talking about housing insecurity and homelessness. And she put all of these images on a path that led the way to the art house to get the community involved there. And then what happened on the block was this is what it looked like at the start of the project, and then this is what it looked like at the end of the project. All of the residents' houses were painted in these beautiful colors in a block-long mural. And now residents tell us that people change their walking paths through the neighborhood so that they can be exposed to this in Mantua, which is really otherwise, it's both a bleak neighborhood in terms of the challenges that people are facing there right now with poverty, but it's also a neighborhood that's rapidly gentrifying. Drexel in particular is buying a lot of the housing there, so there's a great fear of the local neighbors being forced out. Here's the art house. And one of the greatest pleasures of this project was really seeing the street come alive with social interaction, reminding us of the importance of neighborly bonds to well-being and to health. And here are Ferris and Adia after their baby Yoshi was born. And after this project was over, we said we need to keep working. These young people who people said would never stay with us for a year-long project, every one of them stayed with us throughout the year. They welcomed the opportunity to connect with adults who cared about them. And we said we want people like Ferris and Adia to have an opportunity to be leaders in the next phase of the project. So let's train them to help do these interviews and do community outreach. And they did in the second phase called Journey to Home, where our goal was really to keep our focus on the same issue of housing insecurity, but to find other audiences and other ways of getting the stories told. And here's the creative team. We again had a huge list of collaborators, including our local NPR affiliate and they turned all of our interviews into audio murals and radio stories. So from the first phase of the project, we realized that one challenge in terms of community engagement was that we were in a neighborhood that is widely perceived as, and really is by objective measures, a very dangerous neighborhood, where there was not a lot of street traffic and there wasn't easy access via public transportation. So we wanted a more stable home for the project, and we wanted to create a community center where people could drop in and participate, and the conversation could be sustained over another year. So we decided to locate the next phase of the project on this main commercial corridor in the Mantua neighborhood in West Philadelphia on Lancaster Avenue. And we rented a storefront here on Lancaster Avenue. And we again started with photographs as a stimulus for conversation. We asked these young people to describe their journeys to home, and they loved that process. Here, they're standing in front of one of their photographs blown up huge into wallpaper, which is just an interesting, it has an interesting effect of bringing people who visit into the lives of these youth. And this is Tasha and Ferris, who have worked with us for a very long period of time and with great pride. And they and other young people helped organize community events over the course of a year. So we would have a First Friday event where, in this case, with playwright Susanna Berger, the youths took their interviews and turned them into monologues about their life stories. And they also borrowed pieces of other people's interviews, and then they performed them for community residents who really flocked to these events. You know, one thing that I think middle class and upper middle class people can't necessarily appreciate is how few opportunities there are for positive social interaction in safe spaces for young people in neighborhoods like Mantua. So this was really a welcome opportunity, and we provided food and we provided opportunities for creative expression. And here are some of the students who performed that night. We also brought in artists who were very skilled. So Susanna as a playwright, the poet Nina Liraspect Ball then did a spoken word workshop and gave young people an opportunity to practice their writing skills as well as their public speaking and performance skills. And I think for many of these youth, what we saw is that they've mostly gotten attention in their lives for negative things. Many of them have been involved in the juvenile justice system and in other social service systems that deprive them of their humanity and make them feel disrespected and somewhat lost. So to have an opportunity to create and have an audience and to feel proud was something that again and again we saw in these young people as a source of joy in their lives and as a practical way to build their skills. In terms of practical skill building, the young people also helped us build a pop-up gathering space. They were paid for this work. And here you can see the shipping container turned into a stage and a place where we had art exhibits out in the community. And you see people sitting at these tables. We often had the community come together and gave them a particular task to work on together. There's Yoshi growing up, just to give you a sense of the fact that these young people stayed with us longitudinally over time. One of the things the community residents helped us do was to try to visualize how many young people are housing insecure or homeless in Philadelphia. So the artist Jared Wood challenged the local community to build 5,000 paper cranes to represent Philadelphia's 5,000 plus homeless youth. The 1,000 number I told you about was how many youth would sleep in a shelter on any given night. This is a larger number, obviously. So here are some young people gladly taking on the task, and here's Jared in the shipping container, and I think it was very powerful for the young people who themselves had been housing insecure or homeless to be represented through art. And one young man, when this art exhibit was open, Stephen, he got up at the microphone and he said that he was very grateful to Jared for choosing the symbol of the crane. He said, I can really identify with this because like those birds, I too can fly. And I think this project gave the youth a glimpse of the possibilities in their own lives. It's also just very beautiful. And much of what we do in health and in public health can be very difficult and challenging, traumatic for healthcare workers and for the people we're taking care of. And we can see a level of healing that occurs through the process of art making and through the viewing of the art. One of the things we really cared about was providing social resources to the young people who were involved with us and using the project as a way to bring other young people in need to the services and the service providers who could help them. So this is just one example, but on an art making day, we brought these bags into the community and toiletries and socks and items that homeless youth would need. And the neighborhood residents screen printed and made art on these bags, and then the bags of resources were distributed in the community to homeless youth. And you can see the active engagement, I think, is visible in the pictures. And I think it's true in our experience with disadvantaged youth, but it's true, I think, across the socioeconomic gradient that many people are looking for a way to be useful. They're looking for a way to help. And that one thing this project and others like it can do is make it easy for people to have portals into helping, opportunities to connect, and opportunities to do one small thing that can maybe help another human being. So the project itself is also a jobs program, and the young people, as I said, are paid for their employment, and they also can participate in the making of this art to create a sense of permanence and visibility for themselves in the city of Philadelphia. And here, the artist Cheryl Olinsky created these murals with the young people, and they show maps that she had helped them draw depicting their own journeys to home and sort of critical junctures in their lives. Our aim throughout is to get all people involved in the art making and in the social conversation. One of the best parts of the project, and I encourage you to go to the website journeytohome.org, and it's journey2, the number 2, home.org, is that the young people took their interview content and they created music. And the music is really high quality, and we realized that they were getting these very practical technical skills, familiarity with new software, for example, but also that music making was the vernacular for many of these kids. It was something that they felt tremendously proud of at social events when their own music was playing. And here is Michael O'Brien, who was also a social worker, but he led the music making workshops for the youth. And then the music provided the soundtrack for our events. So what we think worked about this project is that we had a clear structure. We had ways for the youth to get involved. We applied the photo elicitation method as a way to engage, and I've used that method now for 10 years with a variety of populations with great success. And in particular, the issue of home is universal. Whether you have one or don't have one, the idea of home as central to our identity and as a crucial need is just universal. So the project could include all people in that conversation. And the young people stayed in the project for the duration. And the project team was also highly engaged because the issue had such resonance. The art making process itself allows for time spent together in active work and reflection, and social services. And so the social service providers who engaged with us liked the idea of taking the social service delivery process out of the typical fluorescent lit, ugly, bureaucratic settings and being able to talk to young people about their needs in a much more human environment and way. And we believe that that works to help reduce stigma. And one of the ways we observed that was that many of the young people did bring their friends along and say, my friend also needs help finding a home or food, for example. And the storefront model in particular worked to engage large crowds over the course of the year. At each event, we had probably 100 people or more. On many nights, the store was packed. And it was clear that there was a desire in the community for that kind of social interaction. The next thing we did was that I spent a summer with a skilled urban street photographer, and we spent time with several students. And this is the transition to our next project, which I want to tell you about. And the two projects are linked because one of the brilliant young men in the first project was the inspiration for the second project. And that young man's name is Brandon Stokes. And Brandon was born in a shelter. He had always been in and out of shelters. He said to me, people call it your disadvantaged background. I would call it my training ground. For Brandon, he said the library was a meetup spot for a lot of shelter kids. I started reading biographies of great leaders. They may not have been homeless, but they overcame great obstacles in their lives. By 8 years old, I wanted to be like them. And during the summer when I was with Brandon, we spent time in the library, and I could see the transformation that happened in Brandon as soon as he walked into that space, which was a kind of like hallowed ground for him. It was very safe space for him. And he immediately went to the biography section and started to go through the books and devour the books, and sort of forgot about me being there with him, and was just passionate about finding great leaders. And he talked to me about why he was doing this, and he was very, very conscious of the fact that male role models were missing from his life, and that he was looking for the lessons available to him in these biographies. And if all of my students were like Brandon, I would feel like a highly effective teacher, because Brandon's goal in life is to find every piece of information that can possibly help him and integrate that information and integrate those strategies into his life. And he is really an incredible model. He's also a reminder to me of just how unfair it is to have such a high standard for young men like Brandon, because he has to have that much ingenuity, grit, determination to make it past his really challenging life circumstances. But Brandon is doing great. He is in college, and he's starting a social impact fund. He said, when I came in for a job interview at this supermarket, I was worried that I didn't have the right thing to wear, that I wasn't prepared. But the manager, she hired me on the spot. She said she saw something special in me. I worked there in the evenings and went to school during the day. And when you meet Brandon, you do see that something special in him. He's very good at connecting and listening. And he said, my brother and I were living at the youth shelter, Covenant House. For good behavior being an example to others, they gave us 8 months to a year to save up money and get our own place. It was like an extra lifeline. And this was actually his first apartment, and he told me about what it felt like to have those keys in his hand and to be able to open a door knowing that this was the door to his place. So from Brandon, what I really learned, and he says this is the scariest time in his life. Now that he's an adult, it's time to see if all his childhood dreams will come true. So Brandon's inspiration to me, well, there are many ways in which Brandon inspires me, but his insight about the importance of the library as a lifeline was such an aha moment for me. Perhaps it should have been obvious to me in public health and community outreach how important a library is in a city where there are few safe spaces for children to play, in a city where the school system is really a disaster. The library provided a spot where he could go. This is Brandon, that we helped train the youth in our program to be advocates, and they've been testifying at the State House in Harrisburg and in Washington, D.C. So anyway, we started this Healthy Library Initiative because of Brandon's inspiration. And I'm just going to give you a very quick overview of what we're doing now with the library system in Philadelphia, so that you can maybe think about working with your public libraries as partners for health. I have a wonderful group of colleagues who are working with me on this project. So we approached the library and said, we want to help you think about health in all your programs. You know, much like the health impact assessment model of thinking about health in all policies, we want them to think about how they can inject a little bit of health in all of their programs. And we did a community needs assessment in South Philadelphia for them, and I'll tell you about some of that work. So just as one example, the Free Library of Philadelphia has what they call a culinary literacy center. It's an innovative in-library commercial kitchen where they bring young people, old people, new immigrants, many different groups of people to learn about healthy cooking and healthy eating. That's not how most people think of the library, but it's a wonderful and highly popular place for people to come and engage and learn, attend nutrition classes, improve their nutritional literacy. And the goal really of this is to improve community nutrition overall. This is the library we're talking about, but it's a new model for the library. And in Philadelphia, in about a month, this new Community Health and Literacy Center is opening. And it's at Broad and Morris, right on a main thoroughfare and subway line. And this Health and Literacy Center is going to have a health-focused library on the first floor, open to the public, and then upstairs, a public health clinic, and upstairs from that, Children's Hospital, CHOP, is having a clinic there on site. And there's also a rec center on site. So it's this brilliant model of combining health and literacy in one place. So we said to the library, we really want to help you think about programming. And I hope that we can call on you in the coming months and years, because I think the goal here is to make this really a destination where people can come to learn about improving their health, and where we can help brilliant researchers, for example, come and translate their findings in a community setting where people are very eager, we learned in our community needs assessment, to learn a great deal about how to live healthier lives. So we see this as a tremendous opportunity, especially because in any given year, half of the US population visits a library. African American people and low-income Americans are more likely than other Americans to ask for help from a librarian. So if we're trying to reach vulnerable populations, the library is a good place to do it, and librarians are good partners to do it. In the Free Library of Philadelphia, one of the things that's really an asset is that the libraries are distributed across the city with 61 branches, serving 5.5 million in-person visits annually, and 8 million more online visits in a city that has 1.5 million people. So this is really an institution that's actively used and valued, and the pink is just the distribution of library branches. So I'm going to briefly tell you about this, but we did community resident interviews and librarian interviews to understand what residents want from their library. And I'll tell you about the 4 key things they want. This young woman talked about trauma in her life. She said, my first life experience close to home was 14. My best friend was killed on the corner of Wilder Street. Then after that, everybody started getting killed. There's always been neighborhood against neighborhood, a lot of shooting, a lot of killing, a lot of funerals, a lot of rest in peace t-shirts. And she really talked about the importance to her and to her children of having a safe place to be, because this is what she said about her when our interviewer asked, what kind of place would you envision, an ideal world for you and your kids? And she said, our own planet, probably, just us. We can start our own population, start over. This is the deep level of despair that we see often in Philadelphia's most dangerous neighborhoods. But what we want the library to provide is a safe space for connecting with those young people. Homelessness was another issue raised time and time again. This young man had been in prison, and when he came out, he had difficulty finding work, difficulty because he had no job skills or interview skills, and he had to do all of that on his own. He was helped ultimately by a librarian who then taught him how to write an email, a cover letter, a resume. And our team, my research manager, said to me, Carolyn, I couldn't believe it, because I got this email from a participant in our project who wanted to get more involved. And it was the most beautifully written email, so professional. And then when she went back to the photos and connected it, it had been written by this young man who had been in prison. So he was someone who was really helped by the skills training available and the lifelong learning available in the library setting. And he said, even the simplest meal was big to me when I was homeless. And one of the things librarians are often doing is helping people find resources in their communities. Children and families, universally in this part of Philadelphia, the focus on family was huge, and among librarians too, the desire to help and connect across the generations was huge. For South Philadelphia, which is a first home in the US for many new immigrants, there was lots of discussion in these interviews about the challenges parents face and their determination to stay to help their children. I'm going to fly through these, and I'll share the slides with you afterwards. But help for new Americans came up a lot. In addition, issues of diversity, inclusion, and racial harmony or discord came up many times in the interviews, and the residents really want the library to be a place that's safe for the coming together of people across socioeconomic groups and across racial and ethnic groups. And this young woman said to us, I want to say ethnic relations, this is what I want the library to do. Something that would bring all the cultures together to sit down to talk, maybe hash out stereotypes or perceived stereotypes that they have about each other, and flatten it out so we can all have a better understanding of who we are. So I think I'll end on this slide just to tell you that librarians talk to us about the most vulnerable populations coming into them. They say people are coming in all the time, applying for work, looking for work, asking to help them with their resume, their cover letter. They're transitioning. I've definitely had people come in who need housing. They might be homeless, they might be looking for a shelter, they might be looking for a new apartment. So what we're doing now is we're running community health trainings for librarians in the Free Library of Philadelphia system. So we're training them about how to recognize and screen for mental illness, how to recognize, how to engage residents in discussion of these challenging issues, and then how to refer them to appropriate resources. So the first trainings I'll just show you are about mental health and substance abuse, homelessness, the needs of new Americans, and how to help new Americans navigate medical and dental care, legal services, understanding of resettlement agencies, and then the needs of children, identifying developmental delays and learning disabilities, and assisting patrons with the school system. So this is a model. I'm happy to answer questions about any of these projects. Our goal is really to meet people in the community where they are, and also, as you've seen in I think both of these examples, the lesson for me as a researcher and public health professional is that, one, our community partner organizations like the Mural Arts Program and like the Free Library of Philadelphia are tremendous community assets and wonderful partners for research and for community engagement. And two, that by getting out of my office into the community, I learned so much more about how I can be helpful and useful to the people who are most disadvantaged in terms of their socioeconomic status or their health. And that's something I wasn't taught in graduate school, but it's something that people like Brandon are really teaching me every day in my work. So thank you, and I'm happy to take any questions.
Amazing. I'm overwhelmed, as I'm sure everyone here is with what you've done. You know, I often reflect that we can't even really begin to get at problems of health without just understanding social determinants and being prepared to act on it. But I think that the challenge as scientists is how we develop good programs and how we develop programs that are even reasonably controlled and develop scientific metrics for what we do. I'm sure this is a challenge for you too. You can reflect on the hard science about this.
Yeah, and I think the whole move with the accountable health communities, the major initiative now through CMS and the Office for Innovation, is really going to test how well we can evaluate the provision of social services and the addressing of social determinants of health, and whether or not we can improve health that way. I think this work is what I would call very early stage work to engage the community and learn about priorities and assets in the community. I think that if what we want to measure is, are people's social circumstances improved, you know, do they have access to the basic building blocks for well-being, we can measure things like that, like who's housed and who is able to have enough money to buy the food that they need. But what we're not measuring then really is only the impact of our intervention. We're measuring the impact of such a tremendously broken system. And I think that's the challenge, and in a way why that wasn't our focus in this project in the first case, because we wanted to first shed light on just how complex these problems are, rather than saying in 6 months we're going to have more of these kids in homes than were housed at the beginning of the study. Because in reality, the the waiting list for public housing in Philadelphia, or for subsidized housing in Philadelphia, is many years long, especially if you don't have HIV, you're not disabled, and especially if you're a young man. So I think we have that challenge. Are we measuring how broken the system is, or are we measuring the incremental gains from our particular small-scale interventions? And I think for that reason, the whole focus on accountable health communities and doing this, push at a much larger level to get people's social determinants of health improved, I think that will be, an important direction for the science. But in terms of, can we do a randomized controlled trial to improve the social determinants of health? As we can see from the stories, it's so complex, right? And are we going to randomize people to receive, amped up SNAP benefits? Are we going to randomize them to receive more food? That would be one place to start. But once you start thinking about what people really need, it's never food in isolation that's the need. I think that's the challenge in working with young people whose needs are so many, so vast. So that may be a dissatisfying answer to your question. I hope that I'll spend my career figuring out.
Lots of work to do.
Yeah. Yes.
One of our online viewers asked if you can comment on the strategy used for the community needs assessment.
Sure. So we did a combination of two different types of interviews. We did walking interviews in the neighborhood, in the areas surrounding the 6 South Philadelphia libraries, and they were street intercept interviews. So we stopped people on the street, aiming for diversity in our sampling, and we interviewed them on the spot, and we had this urban street photographer with us, and his job, Nima's job, was to capture the surrounding environment and document the neighborhood conditions, and also to have a portrait of that person who was interviewed. So those were the people who were interviewed, the people in the photographs I showed you from the library portion. And to me, as a communicator, that's important, because I think it's easy to tune out when the words are just written on the screen, and it's a little bit easier to engage when you can see the human being who is expressing that concern. So that was one part. And then the other part was that we did semi-structured interviews with librarians and library staff, including people like library assistants and security guards. And then we used qualitative coding technique to identify themes in the photos and in the interview transcripts. And you can ask them if that sufficiently answers their question. Thanks. Yes?
You briefly mentioned that one of your neighborhoods, Drexel, was buying property and sort of gentrifying the area. Is there a concern that by making these neighborhoods prettier, you might increase the gentrification process in the future?
Absolutely. And I think it's such a it's a complicated problem, because on one hand, you certainly do want the physical environment and the social environment to be improved for the people who live there, right? The conditions are so deplorable and really unacceptable. And then on the other hand, the first sign that a neighborhood is looking good is the first time that a developer might take notice. And there's a really good and cautionary tale, I guess, in Philadelphia, in the Spring Garden neighborhood, where there was this plot of land that was an active site of drug trade. And, people just bought drugs there all the time, sold drugs there all the time. And the neighborhood residents finally said enough. And they brought in the feds to help break up the drug gangs in the neighborhoods. And many local people from the neighborhood were incarcerated. It was really challenging and disruptive to the neighborhood. And then what happened was that the space that had been kind of this drug market was taken over as a community garden. It's now one of the most beautiful community gardens in the city. It's 1 block square surrounded by this sculptural fence. It's vibrant and thriving. And the real estate values with those views have just skyrocketed. So it is about the unintended consequences of our, well-intentioned interventions. And I'm not sure that there is a good solution, except maybe for the development of mixed income, for mixed income developments where there are opportunities to remain in one's own neighborhood, even as wealthier people move in. But of course, even that is controversial. Yeah. Other questions? Yeah.
So about the library project, are you planning, how many librarians are you planning to train?
Well, they really want us to train all the librarians in the system in Philadelphia, and we're starting small and focusing on the South Philadelphia cluster of 6 libraries and that branch that I showed you. And next we're moving to West Philadelphia, where we completed another community needs assessment recently. We have the will, and if we can find the funding, then we will do that. And our hope is really to develop a scalable model with some online tools and resources too, so that other libraries, other branches in Philadelphia, and other libraries throughout the country can benefit from some of the trainings developed. Yeah. It's so much fun. I mean, to work with librarians, they're trusted in the community. They place a very high value on privacy, which is part of the history of the Red Scare. I didn't know this, but librarians really took a stand about protecting the borrowing records of the patrons, and they succeeded in protecting borrowing records of their patrons, and they're really vigilant now about privacy concerns. And I think that that may be one of the contributing factors and reasons why people trust their librarians and will talk to their librarians. Yeah, do you have a question too? Oh, I thought you were reading that. No, that's okay. Yeah. Other questions?
Well, thanks so much. It was really wonderful.
Thank you.